So the Merlin test is very helpful to me in two particular scenarios. Number one, that would be patients with T1A melanomas that would not necessarily qualify for referral for sentinel node biopsy, but I have had a couple of patients who, with the Merlin test, turned out to be high risk on Merlin test, and then rather than doing the excision and treatment in my office, I referred these patients to surgical oncology for further evaluation and management, including consideration for sentinel lymph node biopsies. But then the Merlin test shows me that they're higher risk. And a couple of the patients that this has happened with in my practice are younger patients. And I know there's data that patients under 42 are at higher risk. And I've had a couple patients in their 30s and 40s who turned out to be T1A patients that were high risk on Merlin testing. I had an elderly patient. He was about 85 years old, and he had a T2, actually had a T2 melanoma on his ear. And he was reluctant to travel to the larger academic center and have the procedure done there, and was very reluctant to consider a sentinel node procedure, and would have had we had a long discussion about this, and it turned out that his Merlin test showed that he was low risk. And again, this head and neck melanoma that is a much more challenging area. So because he was low risk and because he had a number of comorbidities, he decided that he was just going to have the wide local excision done by a plastic surgeon. I had another patient who was a T1B, and she had a melanoma on the arm, and again was perhaps a little concerned going through a sentinel node procedure, since she had a prior history of breast cancer and had lymph nodes in that axilla removed previously years ago. And she had a discussion with a surgical oncologist about this. And when her Merlin test came back low risk, they made the decision to forego the sentinel node procedure, since she would have had higher risk of morbidity, since had already been lymph nodes removed from that regional area. I also had a young man with a T1A. I think his melanoma was 0.34 millimeters in thickness, and his Merlin test came back high risk. And when I sent him to see the surgical oncologist, they made a decision to proceed with the sentinel node biopsy, and it turned out that he did have a positive sentinel node. The Merlin 001 study, will have a great impact on my practice, and I think the practice of many dermatologists and surgical oncologists, frankly, as we move forward. We're now in an era where genomic testing is really going to influence medical decision making. So I think this study is a landmark study, and I think it's going to create a lot of buzz in the field of melanoma.